Today's episode is brought to you by the Hippocratic Collective. Check out all our shows and content at hippocratic-collective.com. Welcome, everyone, to this week's episode of Surgeon Interrupted. I'm so glad that you're here, and we have Dr. Liz Malphrus with us here today. Liz is incredible. You know, we just got to meet recently in Philadelphia at the Pearson Ravitz Clove HC event, but I'd been following her online. She's a UPenn Plastics Chief Resident, which kind of automatically, she's an icon. That's not for the faint of heart. And I just really I feel like your presence online, even before I got to meet you in person, it is so warm. It's warm, it's humble in a way that is like so attractive and likable to me. Like in surgeons, you just don't see that every day.
Yeah. That's really cool. Thanks for saying that. And I had such a good time at the event. Like, I really think I'm just really excited about what y'all are doing. And I have like so many text threads that are going, like plans in the works, just like tons of people that like I only ever meet plastics people because I go to plastic surgery conferences to network. And so other than that, I just like know the people in my hospital. So anyway, it was really fun. Like, I have like all kinds of really cool connections from it. And I'm looking forward to what y'all have got planned.
That's amazing. Yeah, it's so fun. And honestly, like somebody even recently, they were like, okay, so are you guys like doing networking events? And like, is this billed as a networking event? And honestly, no. Networking events, that kind of gives me an ick. No, yeah. Exactly. Well, I mean, but I love so what I am hearing, like genuine connections came from it. And like, that's what it was. It's community really cool. And connection. And I just think that there's something so much more authentic and relaxing about it, because like if someone invited me to a networking event, I mean, I'd probably say no. And then if I did say yes, I would feel uptight about it.
I totally agree. And I think it was actually, that's part of what I loved about it. It was so different from the kind of like when I go to a conference, I'm like in networking mode and it feels very pressury and I have like goals and things. This was just like fun, had some conversations that were really interesting, and like some of them led places and some of them didn't. And it like sort of doesn't matter, but I had a really great time. And all the details were like so good. Like, it's so obvious that you put like all of your surgeon brain power onto it.
Oh my gosh, thank you. Yeah, the surgeon event planner is like a little known, niche that I love.
Yeah, it was amazing.
So I'm very excited to chat with you today, and like there's so much we could get into, but what I thought was just right off the bat for us to start, it was really cool to hear about your story, your background as a violinist. Mm-hmm. Just a few weeks ago, we had Sonia Lee on, and she was she's a daughter of a general surgeon. She was brought up kind of primed to become a surgeon herself. And then, of course, she ended up at Juilliard and really, I mean, just had a prolific career. Currently still has a prolific career as a violinist. It was cool to see like that transition, but with your background, you almost did the inverse journey. And I think it's super
interesting. And I've thought about it some, because I know you posted a lot about your like transition out of surgery, and I just think it's so interesting how like it's just, there's no like right or wrong. It's just like sometimes it's not the right thing for you, and it can still be the right thing for somebody else. And so there's not like any real like value judgment. It just like you fit or you don't, or like it works for you or it doesn't. So like I remember I started out in music. I never thought about going into medicine. My mom's a veterinarian, so I sort of like grew up in her office. But like didn't make me want to do medicine. At least not vet medicine. So
was she on call a lot and things like that?
Yeah, she was she's amazing. My mother is like a force of nature. She is a small businesswoman. She she did everything for that office, and we were like, I spent a lot of time there growing up too. Definitely shaped me like who I am for sure. And like obviously I love her, and she's like been a huge inspiration in a lot of ways. But it's sort of funny actually, because I thought I would never want to do what she does, because it's like was so intense growing up in that environment. And now I'm thinking about going into private practice. So it's very funny how life comes back around. Anyway, so yeah, I was always a violinist. I went to college at Manhattan School of Music, the other lesser known conservatory in New York, which is also still a very great place. And I think for me, it's just like I grew up in South Carolina in sort of a little bit of a more conservative environment. I think I just didn't have exposure to a lot of other ideas. And so I got to New York. New York's so big, and there's like so much to explore that I think I was just I've narrowed down too soon. And so I basically transferred to
Ah,
Columbia, and was like ended up being really interested in the sciences. So that was my first big transition. And one thing that I know you've dealt with that I dealt with at like each time I sort of switched tracks is everyone around you thinks you're losing your mind, think you're crazy. I was like 18 and people were like, "Oh, you're just gonna leave like leave music world." And I was like, "Yes, it's not." Even then people were like, "Isn't it too late? You already started college." You know what I mean?
yeah.
Which is crazy,
That's
but it's like,
crazy to
it's
think
never
about
too
like that.
late. But when you're 18, you don't, to you, that's all your friends are in college. They've all like got a plan. And then I didn't anymore. Anyway, I just think it's interesting because you're dealing with exactly the same thing of people are like, you can't do this now. Or like, it's not allowed. You
I
can't get off
love
the
that.
train.
I
So
love
anyway,
that. Yeah, no, and I totally agree with what you're saying about how it's not a value judgment. Like
no,
I
exactly.
love and I am absolutely like I'm here for your journey, which is the opposite, which
Mhm.
is switching from because I can really identify with narrowing down too early.
Yeah,
That's exactly what I
exactly.
did. I
Yeah.
just um and then I stayed on that train like longer than you stayed on your old
Mhm.
train, but I mean like we're always allowed to get on or off. I think that that's so beautiful. Um
Sure. I think it's also
but
how you get interesting people. Like that's why you like have a unique perspective is that you had a different set of experiences than other people. And like I think without that you miss something.
I
That's how you
think
have a different set of views.
exactly. That's very true. We need that diversity, the
Yeah.
diversity of thought, not just like one homogeneous person running
Mhm.
medicine, as it traditionally has been. But I think that in my 20s, I'm a big quote person and I always was saving
I
all
love
these
quotes
quotes.
too. I did
Yeah,
that too in my especially in my like early 20s. Yeah.
yeah, yeah. And I
I
was
had like
saving them.
post-it notes everywhere.
I'm looking at my post it note wall
Oh,
right now.
really?
Yeah, I'm still a child.
I love
People
that.
think I'm
I
an
use my notes tab now and increasingly anyway, I'm using Substack some too to like keep stuff. Anyway.
Yes, I
Yeah.
love that. No, that's great. I saw this tweet recently that I loved that was like, people sometimes mistake me for an adult because of my age.
Yeah.
I feel that way.
Yes.
But in my 20s, a lot of the rhetoric that was like how people respond to you is a reflection of themselves and not of you.
Mhm.
And I did not truly get it until my 30s. And I definitely get it now because, for instance, when I come out here and I recently this week was talking about how, like, a lot of people, what I find in medicine is that they aren't as stuck as they think they are in medicine. They
Mhm.
just can't let go of some of the prestige. Like, I almost did a
That's
fellowship.
interesting.
If you've known one fact about me, you would think, oh, that person, like, why would they ever do a fellowship? They already,
Yeah.
like, didn't
Someone
really
needed to
like
get out
generally.
of training. Yeah.
Exactly. Like, why go deeper into the crevasse? Literally. So, but as a end of PGY 3 year, I was like,
Mhm.
okay, Colin, like, let's figure out, do we want to do plastics? Do we want to do like maybe PDNT? He was like, why would you do a fellowship? Like, are you okay? And I was like, well, because you got to do a fellowship. And, like,
Yeah.
it took 6 months to get over that. And then I was like, well, I can't leave academia. And he's like, why not? And I was like,
No.
because,
How dare
it's,
you?
well, yeah, it's embarrassing. What will people think? He was like, I guarantee you. And this is why, like, Colin's the VIP because he was like, oh, I guarantee you, like, nobody outside the hospital knows what academics is versus not.
Yes.
He was like, just FYI, like, my friends and family know that you're a doctor. That's pretty good. Some of them know what an ENT is. Doesn't
That's it.
really matter. Like,
Yeah.
so to chase the diminishing returns of like acceptance from these couple people, it really helped me work through like freeing myself. But the point that I just want to make is that when I shared that, like, hey, I had to let go of attachment to prestige to give up fellowship, give up academia.
Mhm.
And there's been all these people being like, fellowships are important. If there was no academia, like science wouldn't advance. And it's like, of course, I think academia and fellowships are
Yeah. It's just not
important.
for you.
Exactly. But when people make it like, wow, how dare you attack the institution? It's like, well, it wasn't an attack of the institution. You're kind of
Yeah.
telling on yourself.
Exactly. Yeah, I think it's I'm excited because I feel like especially the like I'm an older resident, I'm 36. I think especially the like next generation, like the Gen Z people that are coming in now, I think they care about prestige way less. At least that's
Hmm.
my perception. Like they're way more focused on like, does this job make sense for my life? Like, am I going to be happy? Are these things I actually care about? And I think that's really positive. And I feel similar to you. I feel like I've aged into caring less about prestige. Like I went to Columbia. Like I was like really
Yeah.
into, I worked in the White House, I was really into chasing all of this like niche stuff in really all of my careers before this. And even for residency, like I went to the very best program I could possibly get into.
Yeah.
I love it, but it's not the prestige that is making it great. It's like you know what I mean? The prestige itself doesn't actually matter. So
Yes,
anyway,
and
at least to me anymore.
no, I love that, but, like, we're in recovery. I
Yeah,
agree. Like, it's
exactly. Yeah.
incredible when you do look at your CV, like, kind of where you've been professionally and personally. Um, I guess, how do you feel that you were able to age out of it? And, like, at what point in your career did that happen? Did it happen mid-residency for you? Kind of for me, maybe senior years of residency.
Yeah. I mean, I don't know. I feel just fortunate that I've had multiple different careers, and I think each one of them helped me sort of shake out what I actually care about. I think part of it is just like being inside the house. I think when I was younger, I felt like I needed the prestige to sort of make up for the things about me that I didn't actually think were like acceptable or appropriate to be in those spaces. I definitely did not. I never thought I was smart enough to be a doctor. I think a lot of it for me was like replacing that self-esteem with like external validation.
Mhm.
And so for me, it was really it's been a long process. I think I got a lot better in med school through therapy, honestly, of like just sort of being
Mhm.
better about understanding your own feelings and what actually matters to you. And then I think being in residency, being a doctor, especially in surgery is so real. Everything is it's very real. It's people's lives. It's a serious business. And I think it sort of helps put things in perspective of like the reason I want to do surgery is about taking care of my patients and doing this work and working with the patients. And for me, at least, like the research side of things, which you need to get here when it gets down to like, I needed to do a lot of research to get to this point. Now that I'm here, it doesn't really compel me in the same way. And we all have limited
Mhm.
time. You have to make choices about what you want to spend your time on. So for me, that's why I've really like come down to focusing my career around like clinical goals and what I want my
Mhm.
patient care to look like. And letting some of the other stuff go, just being like, it's okay, you know? I've been saying I'm retired from research. It's probably a lie, but I'm trying.
I love that. Yeah, you're trying to retire from
Yeah,
research. I
it's
really
hard. It's
am.
like where there's a lot of yeah, you are well, I don't know. I don't know. We'll
I'm
see.
having fun. No,
You
oh no,
never know.
I'm really retired from research, but I get it. And I mean, again, yeah, like
Yeah,
you're a plastics chief at UPenn. Like I do believe in giving yourself all the flowers for that. And
for
like,
sure. Yeah.
um, but I love, and again, I just so identify. I do think that there's something, just really special about like getting to talk to female surgeons
Mhm.
who you can relate to because by definition, my whole journey where things got good for me professionally and personally was when I felt like I didn't have to prove myself
Mhm.
anymore. And what's funny is by going through that whole journey, and then it was after like our written boards, I got the message that I had passed and I broke down crying in part relief
You
because
finally
it was
made it.
hard. Yeah,
Yeah.
but again, like my first thought was I can leave now.
Oh, wow.
So I'm saying like
Yeah.
I
I'm
had
so
put a
glad you got
lot.
out. Like, yeah, you had invested so much in this and like, yeah.
Yeah, but I do think, with how bad my residency was and stuff like that, like, I do think that passing that test was, like, me proving something to me. That was, like, a
Yeah,
very
totally.
personal fight. Like, I
100%.
genuinely don't think my family saw me
No one knows
different. I
about that.
would
Yeah,
definitely
it's
think,
sort of
my
similar. Yeah.
friends wouldn't see me. I mean, like, again, your real friends, like, they just don't care. Most of my
They
real
don't.
friends are not in medicine, so they really, really don't care. If I
They
was
don't
like,
even know. Yeah.
yeah, if I was like, "Hey, I didn't pass that test," they'd be like, "Are you still taking tests in your 30s? Like, what are you even doing?" I mean, yeah, exactly.
Yeah.
But
Why do
I
you
do
accept
think
this?
I know, seriously, they'd be like, "Do you know that there are jobs that don't have like exams
Yeah,
like this in
most
your
of
30s?"
them. Most of them.
But
Yeah,
I
speaking
think that
sorry, I'm speaking of like quotes because you said quotes. There's a quote that I keep thinking of during this conversation, which is that we tend to overestimate how much people think about us and then underestimate how much people like us. So I feel like I too have been like, especially like when I decided I wasn't going to pursue an academic career out of residency, I was really stressed about like people are going to be unhappy that I made this choice and like they're going to judge me and like think that I'm like a bad resident and wasting my training and that I didn't choose to kind of follow in their footsteps. And like some people said maybe a few things that I was like, but no one No one really cares because they're the main characters of their story. They don't really care that much about your choices. I think my biggest supporters are people who were like, immediately accepting, but even the little bit of negativity I got over in a day or two, you know what I
Yeah, they
mean?
don't
Like
care
people
that
just
much,
they just
totally.
move on, you know?
I
Yeah.
think I've heard that called, like, the spotlight effect. Yeah,
Yeah,
where,
exactly.
the
Exactly.
fallacy that
Yeah.
exactly, and that is so freeing. That please
Mhm.
feel free to apply that to every single part of your life. The wisdom that Liz
Exactly.
just
Yeah.
shared, like, that is just true, right? Like, "Oh, I wore something goofy to this party. I said
Yeah.
something weird at this party." It's like, I mean, I do think no one's thinking about us as much as we worry that they are.
Yeah. And also medicine is really good. I feel like I've always like felt embarrassment very acutely until residency. And I think residency, there's just so many like embarrassing things that happen that it just stopped. Like my body stopped reacting that way. Like I just don't like I mean, obviously there are like acute cases, but like I think that is something I really appreciate about this training is like you're forced to learn so much so fast and you have to just learn it by doing it wrong. And at some point you're just like, okay. You're like, I don't know.
Totally. I love that, and I think I got that superpower as well. I don't
Yeah,
know if
it
it
is a
was like
superpower.
yeah, and I don't 100% know where I got it. I will say I've always,
It could
you
be
know
age. It could just be age too, honestly.
yeah, right, I know, seriously, like, women in their 30s, are just
Yeah,
women in their 20s with money now. I saw
exactly,
that
and
recently, and I
self-esteem.
love
Yeah.
that. Yeah, but I just really think with the embarrassment piece that, I totally agree. It's training was mostly embarrassing for me.
Yeah,
So, like, if I felt embarrassment, which I don't, then it would have been untenable. But I
exactly.
think
Yeah.
in a world of people pleasers too, though,
Mhm,
maybe I'd love to hear if this resonates with you at all. I get a lot of feedback that from business partners, from my husband, stuff like that.
mhm.
They're like, oh, you don't appear to get uncomfortable if other people are uncomfortable.
Oh, interesting.
And I was like,
That's also a
nope,
superpower.
happy as a clam. Yeah. Well, and
Yeah.
especially, and honestly, I would not say that about like patient pain, by the way.
Mhm.
That was
Yeah,
always
of
really
course.
brutal for me. Like awake procedures, we were doing
Oh, yeah, it's
PTAs in
horrible.
the winter,
Yeah.
stuff like that. Awful. Like I feel all of that, but I'm saying if we're having like a business negotiation and
Yeah,
somebody is like squirming in silence, like it's never going to be me. I'm just chilling.
yeah.
This is the least of my problems. You know what I mean?
Yeah,
Like
I think that's
that's
part of
its
it is
own.
the like the bigger problems thing. I think that's part of it with medical training is like you deal with much bigger problems. It's funny to think back. I think like people's brains just adjust to the level of risk that they experience and are exposed to every day. So honestly, I've never been so stressed and burnt out as when I worked in health policy, even though literally we're talking about documents and meetings. That was the highest, you know what I mean? The stakes overall
Mhm.
were much lower. And sometimes it's like you would think that that would mean that I was less stressed, but I was actually more stressed. And it's just because I think it wasn't in the right spot, you know? But so I don't know. I
Mhm.
think in medicine, you get like the level of like intensity that you're dealing with is so high that like things that used to bother me don't bother me anymore. It's just like, whatever.
Yeah, I love that. And tincture of time too. Like you
For
said,
sure.
I do
Yeah,
think probably age is part of it. Like who knows what we would
definitely.
have sounded like if this podcast was being recorded a decade ago.
So
I
true.
for
Yeah.
yeah. I one thing that I really loved that you pointed out is that Gen Z does not buy into prestige the same
Yeah.
way that all the rest of us have.
It's a
I
good
love
thing.
that.
Hmm.
I love it so much, but guess what? That's actually something specifically that I think is driving older people insane. Like that's what they're railing against. Literally, I see
You
this
mean like
tension
their
and this
reaction
push
to
and pull.
Gen Z in the workplace?
Correct, exactly.
Yeah.
Like the
Yeah.
the
Yeah.
general backlash, but even in medicine we're seeing this, right? Of just like this is crazy, people don't want to work hard. I mean, the Washington Post did that big in-depth piece on like an older
Yeah.
surgeon being like, "Yeah, it's crazy. Like I'm 30 years into my career, young people just don't want to work hard." I think that just because Gen Z values I'm a
Mhm.
millennial, solidly
Me too.
millennial,
Elder
but
millennial. Yeah.
definitely yeah, identify more. I actually feel like I'm a millennial who had Gen Z values kind
Yeah.
of in the wrong
You were
era.
ahead of your time. Yeah.
Yes, I was never meant to get appreciated in real time, but I agree with Gen Z being like, what makes sense for me? And I just like am not going to buy into, and you can't like pay me in
Exactly.
prestige. That's like a bad form of currency.
It is
I
you
my
cannot eat prestige. It'd be great if you could, but Yeah.
some people have been dining out on their prestige for
Yeah.
just their whole career. And like now they're mad because they're like, why won't you buy into this system that like I
Exactly.
love and I sit at the top of?
I know. It's really interesting. I think part of it too is a reaction to how much the health system has changed. Like when you hear those stories that people tell back in my day, things were so different and we worked so hard, we lived in the hospital. I think all that is true. I like believe that, but I think what's changed is that when you were a doctor then, you had so much more say and so much more control, I think, and just a totally different position. Like now, if you're part of the healthcare system, like healthcare system's become this huge business, like everything is driven by this executive leadership decisions. Like there's all these outside forces that are like smooshing you all the time. And there was some of that back then, but I think that is why now we're training doctors to be employees instead of to be like independent like thinkers going out into some small community to like take care of the people. Like it's just, and if you're an employee, like that's when you're like, I should get benefits. Like I should be treated like humanely. Like I should, you know what I mean? It's just, it totally changes the view. So I think
And
that's part of it too.
yeah, and just wanting like fair compensation. I mean, I
Yeah.
recently was talking to an academician. They're new, like newer attending, and they were like, okay, I signed a contract for 50 hours a week at this rate. I was routinely working like 60, 70, 80 hours a week. And so, and then when I said, hey, I'm contracted for this, like I would like to work closer to that, they told her, like, you're not a team player. That's crazy. Like you're new
Yeah.
attending here, so not an option. She had to drop down FTEs.
Wow.
She dropped down to like zero. 0.9 FTEs just to try to get closer to what were her contracted hours.
Yeah.
And like
That's
that did
crazy.
not see, yeah, exactly. And I think that like that was not a setup that was fulfilling for that person, right?
Yeah, it just didn't make sense. Yeah. And to be super clear, like I'm only speaking for myself. Like I certainly don't represent Penn. And I think I'm really fortunate. And like part of what I looked at when I picked a residency program was like I want to be somewhere where they have a lot of resources, a lot of support, because I think that's often where the sticking point is. It's like if you go to a program where they don't have resources and support, it's all going to come down on the residents. And like that's where the give is, and that's where the shock absorber for the whole system. And so I feel really fortunate, but I recognize there are big problems in our system writ large.
I love that. Well, and I think I see, is it Louis? Is that right?
Louis, yeah, where'd he go?
He went up the
Okay.
stairs.
Oh yeah.
He
Yeah.
absconded.
Yeah, it's nap
Yeah.
time. It's like nap 3 of the day or something, probably.
Oh, to be the
To
pet
be a cat, I think
of
about it all
a
the time. I would love to be my cat. He has an amazing life. He just like eats, takes naps in sunbeams. Like that's pretty much
ditto.
it.
Ditto. My cat, she is living a good life. She's a Maine Coon.
Oh,
And
I love Mannequins.
yeah, she's got a beautiful coat. I'll give her that. She's
Mhm.
got a big personality. She brings in mice all of like the mice baby season, which I
Oh
think is the
no.
fall. I don't know. Y'all can tell me if you I don't even want to know, so I don't look it up. Mice
Yeah.
season, I remember in like October, she'll be bringing in a lot of mice. And then her
So gross.
favorite activity right now, which by the way, she's an indoor cat. So my husband, who is her best friend, he lets her out
Uh-huh.
for like monitored time
Oh,
in
okay.
the
And she still
like
managed to catch mice during monitored time?
yeah, during monitored yard time, like 45 minutes here and there. I mean,
Very
sometimes she
expressive.
push yeah, yeah. So
Yeah.
she'll do mice. They're like baby mice. They can't get away. And then now lately every day she's brought in one cricket per day,
Those
which I
big
don't
juicy
love.
ones, those juicy crickets, I can see why they would find those appealing. Yeah, Louis is like like he doesn't do anything and he's like getting a little older, but this past winter he killed and disemboweled 2 mice and just left them on the floor. And I was like so shocked. I was like, I cannot believe he still has all of his whatever
Evolutionary
essential. Like
like
he was so
killing
into
genes.
it.
That's
Yeah, yeah. I
crazy.
never even found the entire, he
No.
like dismembered the whole thing. It was crazy. Anyway, so he's still dangerous, dangerous creature, a wild animal.
Oh. Yeah, it's so interesting too because I think that there's different cat personalities because that is
Definitely.
insane.
Yeah.
I've never seen Edley even really kill something.
Oh, really?
She is Tom and
Just for
Jerry.
sport.
She
Yeah.
plays with them. Exactly. Like
Yeah.
even with a bug, you'll see her follow the bug, bat it,
Yeah.
mess with it. I mean, for just half an hour if she wants
Just
to.
for
She's not
amusement.
trying to kill them. Yeah, and she doesn't eat
Yeah.
them.
It's a
And
toy
she
come
does
to life.
Louis on another one.
Oh
Louis
yeah,
is
so Louis
like,
was a street cat. Louis, I think, is we adopted him as an adult, and I think that's what it is. Something triggers his like he at one point was killing things to survive, so he
that
knows what
makes
he's doing.
sense. It's also such a great reminder, like, a lot of people, I think, with human beings and with us, sometimes you have to be like, okay, my reptilian brain has
Yes.
taken over and it's trying to tell me
Mhm.
something. Like, I should not do whatever the human non-criminal equivalent is of
Yeah,
disemboweling a mouse,
for
like,
sure.
but right, like, or don't send that text. Like, that's
Yeah.
not right. It's your
Yes, yes.
reptilian brain
I
and the
know.
scarcity mindset is telling you to like do this crazy thing. Don't do it.
For sure. Yeah, I know. Yeah. I'm very fortunate. I know you have the same. My husband is not in medicine, and I've benefited so much from just having someone who's not part of this world to like bounce things off of. Because often the response I get is he's like, this job is like totally different than any other job before, in any other workplace. None of this would make sense anyway. And he's like very good at kind of grounding me and letting me remember. You also can get so bogged down in kind of the details of residency when ultimately you're just the goal is to get a job and to like get
Yeah.
the training you need to do that job well. But there's so, it's like it's a little
Yeah.
bit like college or like a sorority or something. There's all this other stuff that goes into it. So anyway, I would advise a very supportive partner who's not in your field. It's really nice.
Yeah, and I really think not in medicine. There's
Yeah.
something magical about that. But honestly, I think that because you were a non-trad and had worked
Mhm.
other jobs, like you have multiple advantages here. I
Mhm.
think non-trad students do much better. They have like some
I
real
think
life
so too.
experience. And so you could even compare it to other jobs. And then two, marrying somebody outside of medicine,
Hmm.
like, absolutely. But because I never lived outside of medicine, it was actually necessary that my husband be the one to tell me, like,
Yeah,
not all jobs are like this. It's crazy because
exactly.
my friends from inside medicine, when I share all these stories, they shrug. They're
They're like,
they're
yeah,
just like
that's the way
they're
it is.
they're like, "It be like that." Like, "I'm
Yeah,
sorry that happened
exactly.
to you, but it be like that." Whereas
Yeah.
it really requires, fortunately, I think non-trad students can filter things through that lens for themselves.
Yeah, I really value that experience. Like, I think honestly, if I was going to start a med school, one of the prerequisites would be to have worked in food service or retail. Because if you work one of those jobs, like, I think part of it is just learning what it's like to have a job and like what it feels like to have a normal like job where you just have to clock in, clock out, and that you are not important. I think part of what's crazy about the straight through pathway is you get to the end and you have to learn how to have a job and how to be a doctor like all at the same time with the least possible guidance and the
Mhm.
most kind of like potential opportunity to mess it up, like honestly, because it's like
Yeah.
there's no one there, there's no guardrails at that point. So anyway, I feel like I really benefited from those early experiences. And then one thing that I think about all the time is kind of like I mentioned before, like having had a job where I was very successful but not happy. I just think back on
Yeah.
that when things are hard in this job, I think back and I'm like, I'm still so happy that I left. And this is the struggle that I choose for myself. You know what I mean? This job is very hard. It's like very, sometimes I wish that I would have been, landed somewhere where things were easier, but you know, this
Yeah.
is, you can't change who you are. Honestly, this was going to happen to me anyway.
Exactly, and
Yeah.
I feel that so strongly right now. Like,
Hmm.
again, I am working. Colin has pointed out to me, he's the one who was like, "This is junior residency hours
Yeah. Yeah.
again."
Yeah. Yeah.
In the 3 months since I left my full-time hospital job, I am working harder than ever, really harder than I ever
Yeah.
had to, like, mentate, certainly, like,
For
to do
sure.
general ENT work, learning a whole new skill set. Um, and I love it. And, like, when I have bad days, I can just be like, "Well, at least I inherently like the stuff I'm doing, and also
Yeah.
at least
And
I
you chose this,
inherently like
you
the
know?
people." Exactly. I
Yeah.
chose it.
Exactly. Yeah.
I like the people. I like the stuff in general. Plus, I
Yeah.
know what it feels like, all that friction that comes, you alluded to, like,
Hmm.
kinda like tension, the friction that comes from, "This is a really stressful job that I
Hmm.
don't want."
Yeah.
Feels
Exactly.
different from, "This is a really stressful job. I
Yeah.
chose this. I'm gonna leave it all on the court."
Hmm.
So
Exactly.
I
It just
love
makes
that
more
for
sense.
us.
Yeah,
Yeah,
exactly.
but
I feel like yeah, I read something recently on Substack. I can send you the link to it. I don't remember
yeah,
who wrote it, but it was amazing partly like talking about this thing of like I think we sometimes think that like if we people say if you do what you love, you'll never work a day in your life, and that's such a lie. And I think really
yeah,
the bad message to send people like where all the jobs I've had have been very hard. You know what I mean? Like including like music. That was really, really hard. It's just more about like picking where you want to be. And like I think the fact that it's hard doesn't make, and that you struggle with it and then you have really bad days. And like, I have cried so many days in residency, honestly, and like did in all my other jobs too. That's the growing part. That's the good part. But even though it like feels bad in the moment, that's how you get somewhere that's really meaningful. You know what I mean?
Mhm.
If it's all just easy every day, then it'll be fun day to day, but you won't build anything, you know? Anyway, so I feel like for you, the reason you're going to be successful is you have an extreme work ethic and an extreme tolerance for
Mhm.
work because of your experience as a surgeon. And like, I'm just so curious to see, no one else has that in your role now. And so I'm
Yeah,
curious to see, like, that level of intensity has never been brought to this kind of area. You know what I mean? So anyway, I'm excited to see what you come
totally.
up with. It's cool. Yeah.
Oh, thank you. And I just appreciate, like, I feel very seen by you, and I appreciate you not like judging the decision, but I
Yeah.
think that when your life has taken a similar like mosaic approach, a
Hmm.
circuitous path to end up at like what you really chose, I do think that those people just tend to get it more easily and maybe like
Yeah,
have grace for it. Because
for
we
sure.
all
No, I
deserve
understand it. Yeah.
what we have.
Well, and people always like people have a weird inclination almost to think that it's like contagious. So if they allow
Yes.
you, if you can leave, then like those a lot of those people that I think are responding the most negatively are people who probably on some level like aren't that happy where they are, but they didn't think that leaving was an option. And then you did it. So it
A
was an option.
hundred
So you're like
percent.
you're messing with their worldview. They can't accept it. So that's
Yeah.
why people are mad. Like,
And people are like, if we could just leave whenever we wanted, we would all leave. And I'm like, that
that's
kind
like
of, again, this
that's
feels like
crazy then.
you're
Like,
fighting
we
with
have
yourself.
a problem.
Yeah,
We need to fix
exactly.
that. Yeah.
Yeah.
We like that's like I don't know. I'm really concerned. I am honestly I think that our profession, like in general, like medicine, doctoring, is not in a good place right now. Like I just think there's a lot that we need to do to make things better. But then at the same time, like each individual has to like you have to make life for yourself. And so like in some ways, like I feel like I definitely came into residency thinking I was going to do like, work in academia and that I was going to do like recon and that was going to be my focus.
Mhm.
And it's just funny how life happened. It turns out that's not the right thing for me, in terms of how I want to live my life. And so I made a different choice and like, it doesn't mean I'm still very invested in like, I think we all have to be a part of making things better for the next generation. And that's still super important to me. But I'm doing that though on my own terms. I feel like I've worked in the system for a long time and I'm at a point where I have to now work outside the system,
Yeah.
which
And
you're also
and
kind of part of. Yeah.
exactly. All the
Yeah.
people who are commenting for me and they're like, "Wow, you could have stayed in medicine and changed it. And now instead you're deserting all physicians." It's like
No, you're
I
changing it
literally
from the
made
outside.
yeah,
Yeah.
why if I was like, "See you later, physicians. I'm never gonna, like, think about medicine again." Why would I
Yeah.
create a physician media company? Like,
Yeah.
what are
Exactly.
we doing
Yeah.
here? What are you
The
talking about?
markets you care about. Yeah.
And this is how we change it meaningfully. So I'm
Yeah.
so grateful to you, and I'm excited for, like, our continued conversations
Yeah.
and,
Me too. Yeah. We'll find
collaboration.
something to do. I'm still thinking about what sort of like video series or something we can do. So anyway.
Yeah. Okay,
Yeah.
perfect. I'm gonna clap because 'cause we'll cut out, like, the preview.
Okay. Should I
Okay.
clap too? Okay. No.
We
Oh, you're
do
just doing one clap.
it's one clap. It's one clap. That was a lot of claps, but I love
It's like
it.
a clap. It's
A
like a
round of
clap or
applause.
clap. A
Yeah,
clap or
yeah.
clap. I got it.
Exactly, to sync AB. Okay.
We can do this. We'll cut, 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 cut. And cut that
I love it.
out.
Any
Okay, cool.
final so, it's been such a joy to chat with you
This is
today.
my
Like,
fun. Yeah.
honestly, we're gonna have to keep talking.
Yes,
Do you
let's do.
have any final words of wisdom or a favorite quote for the moment that you'd love to leave us with today?
Oh my God. Wow, that's a lot of pressure. I don't know. I'll use I've said this before many times on the internet, but it is my favorite quote, which is that if you can't find the mayor, you are the mayor. It's actually a line from a Vampire Weekend song, which is like very random, but I think that sentiment is really important to me and is, I think, important, like can work for everybody. Because it's just like if things aren't happening the way you want, or like if someone's not doing something that needs to be done, like then it's you. Like you can do it. We can all like take, step into whatever role is there and like always be looking for places where people aren't doing something. Like that's where you have an opportunity to really seize the moment. So anyway, and in the hospital, it just means like there's no real job like description for a resident. So if someone's not doing it, like, and it needs to be done, it's you, and you learn from figuring things out. So anyway,
I
we're all
think
the mayor.
that's a huge fan of that quote, and that's another trait, I think, of a really successful person, right? Even the level
Definitely.
of agency behind that. I
Yeah.
see and appreciate it. I'm glad that we all, have you to learn from. So thank you for
Oh,
being
thanks.
here.
You too. Yeah. This was awesome.
Follow me on Instagram and TikTok at FrancisMayMD. Check out our website, hippocratic-collective.com, for more shows and content like this. Thank you for tuning in to this episode of Surgeon Interrupted. If you enjoyed it, please subscribe, rate, and leave us a review. And just remember, your story doesn't have to make sense to everyone. It just has to make sense to you.